alarming reports about microplastics. Researchers are finding them in our blood, our brain, and inside our lungs. They say on average, humans ingest about a credit card's worth of plastics every week. And we're not talking about spending, we're talking about the physical size of a credit card going into your body. Let's talk now with our friend, Dr. Matthew Knight. He is the president of Knight Dermatology Institute here in Central Florida. Good morning, my friends. Great to see you.
Thanks for having me.
Always a pleasure. I can't believe I'm reading that. What are microplastics? What are nanoplastics?
Yeah, so plastics are everywhere. And the global production of plastics is going to shoot up by like 100% in the next 20 years. And the problem with plastic is that it doesn't really ever go away. Some of them do, but a lot of them, like those polystyrene cups, they never really degrade. They just break down into smaller pieces with heat or friction or other things. So microplastics are things that are smaller than the size of a pencil eraser. Nanoplastics are super tiny little pieces that can get inside our lungs and inside our gut and eventually inside our bodies.
So the nanoplastics are going into us.
Yeah, mostly inhaled. And it also goes along with other things that I'm sure you've heard of, like in the manufacturing of plastics, there's BPA, which is an endocrine disruptor that can cause all kinds of nasty stuff, and they've taken that out of a lot of things, but there's no evidence that BPF or BPS is better than BPA. So it's not just the plastics, it's things that ride along with them, and the crazy thing is that you can find them everywhere. So you can find plastics at the bottom of the ocean trench, at the top of the Himalayas, in the Antarctic ice shelf, and inside our bodies.
Yeah, and we're drinking water. We've been doing it for decades now out of these plastic bottles. Clearly not a great idea, but we do it.
Yeah.
It's convenient.
Well, here's a crazy thing. There was a study about 4 months ago, and it was in the New England Journal of Medicine, and they had these folks that were having their carotid arteries scooped out, and they looked inside the plaques, and they found microplastics in like 60 to 70% of these people. And here's the kicker. When they followed these folks for 3 to 4 years, they had a higher risk of heart disease and other problems. The problem is we don't know if there's causation. What I mean by that is, are the microplastics causing the heart disease, or are these people just more likely to accumulate it? We don't know. And one of the big problems is the testing equipment to test for microplastics contains plastic. So there's a lot of contamination, and it's really hard to study. But animal studies have shown that microplastics can act like a foreign body inside us and lead to a lot of inflammation and oxidative stress. And so it's something I find very interesting.
All right, so what do we do? How do we cut back on plastic?
Yeah, well, the one thing we can't do is freak out, right? It's everywhere.
Right.
We really can't get away from it. But there are some common sense things you can do.
Right.
One of them is plastic containers, when heated, like in the microwave, release microplastics into our food. So don't put the plastic in the microwave, use glass and things like that.
Okay.
And that goes for beverage cups too. So if you can use ceramic coffee cups that when you pour the hot coffee in there, it doesn't release the microplastics like paper cups do. The problem with paper cups is if you pour hot coffee into them, they just melt. So they coat them with plastic on the inside. And so hot beverages are something we need to look out for. Also, a lot of ultra-processed foods are packaged in plastic, and they have microplastics inside them. And we talked about heat releasing microplastics. You don't know if this water bottle's been sitting behind a pallet somewhere, behind a warehouse, exposed to the sun all day long, which would release microplastics into the water.
Absolutely. Even the candy bars are sitting inside a box.
Yeah,
and shipping.
Inside plastic.
And how many of us keep these things in our cars?
A ton.
In Florida,
yeah.
Right in the center console.
And so if you can do glass, it's better. And then a lot of people do reverse osmosis water, which is a system that can take microplastics out of your water. Yeah. The problem is it's slow, it wastes a lot of water, and it can be kind of expensive. But you can do little single-use, we're called RO, reverse osmosis systems. I'm not sure how I feel about that because it can take other things out of the water that we need, like calcium and potassium. But it may not be a horrible idea. I don't think people need whole house reverse osmosis systems. But the bottom line is we're never going to get away from plastics and microplastics, and we need to do a lot of studying here. But common sense stuff like, don't microwave your lunch in a plastic container and trying to stay away from plastic water bottles, common sense things we can do every day.
Are your patients coming in talking about this?
I think everybody's talking about this because it's an emerging field. And we know it's out there. Again, the global production of plastics is going to double in the next few years, and it's already off the charts. Like 500 million tons of plastic is produced worldwide every single year. And so it's out there. We can't get away from it. We're not really sure how it affects our human biology, but I think just common sense things we can do.
All right, so don't freak out, but if you do have a problem, go give Dr. Knight a call. President of the Knight Dermatology Institute. You're fantastic, my friend.
Have an awesome weekend.
Appreciate it. Enjoy your weekend, too.